And so can I welcome our final speaker before lunch, please? Krista from the USA.
Okay, I'm from the Iowa chapter for the ALS Association. So no conflict of interest or disclosures to report. These are the outcomes I'm hoping will come from the presentation. Hopefully you'll see the potential benefits to collaborating with other agencies similar to your own, and we're going to give a nod to the barriers that can exist to do that, and hopefully this will also spark your interest in collaborating with other agencies and creating an online resource tool. So, history. In 2014 at the ALS Association Clinical Conference, I attended 2 different presentations that spoke to online resources and the importance of them. The Minnesota, North Dakota, South Dakota chapter had developed and spent many months and hours designing, thinking about editing, writing, doing a beta test to create their own tool, and it was absolutely amazing. And they were also very willing to share that information with other chapters or individuals. And I'm going to say, henceforth, I'm going to say Minnesota chapter. They are the Minnesota, North Dakota, South Dakota chapter, but it's a mouthful, so just so you know. Also, the Greater Philadelphia chapter did some research, studied what families impacted by ALS were actually doing for information. At the time, they were providing a symposium for folks and people weren't coming, and they wondered why that was. And in that research, they identified that the majority of those families and patients accessed information online. So they identified some recommendations that had to do with providing quality internet sites and resources and introducing those resources at clinics. So when I had enough time to actually consider creating an online tool, I included a question in our annual survey. We asked families what new resources they would like. Now, we do put a list of different resources on the survey that we know we could consider providing. We also asked for open-ended feedback, and so this was when I included it in the survey, because I could have some time devoted to developing or recreating or helping identify a new program. And we do call families if they don't and encourage them to complete our survey, so we had a very good survey response rate of 61%, and over almost half of them wanted an online resource tool. So what are the benefits? Easy access, not only for the patients and families, but also for professionals looking for new information. It's easy to reference it at a clinic visit. It's easier for families to look at it when they want to, the information. That's the individual control piece. I think when you're living with ALS and you don't have control over the disease process, the different things happening in your life, it's so important that they're able to access information when they want to receive it and at their own control. So I really like the information uniformity. So what I mean by that is, in the past when I would do home visits, I talk loud so I'm trying to, when I past did home visits, I would have to create a email follow-up to the questions or needs families had. And it could take me a good hour to create or write that email. With this resource, after a clinic visit, if there's needs or concerns, I can guide them to certain pages on our tool, and it takes me maybe 5-10 minutes to complete it. And it's the same information, but it's all in one place. So it's huge. And this also helps the staff that I'm training, new care services coordinators, and helps them with their time frame and their follow-up emails after home visits. Environmental benefits are, decreased paper use, and then the economic benefits. Time is money, so the time that I'm wasting writing an email, I can direct people to that resource, and time also wasted with making copies or mailing things I'm not having to do. So what are the benefits to collaborating? For me, collaboration is synergy, and when I did my social work degree, the thing I learned is synergy is an amazing, amazing factor, and that if you put 2 or more people together that have the same desire, same goal, you're going to get a much more boom, I would say, result than you would trying to do it on your own. And so not reinventing the wheel and looking outside myself to other ideas and information, it's the thing that gets me excited about this disease and collaborating with other people. So, Benefits to collaboration: time and financial efficiency, new ideas and information you may not have even considered, including on an online tool, and you improve the relationships with those other chapters or perhaps other agencies, whatever you choose to do. And then just increasing the strength, the shared purpose, trying to find better resources for people living with ALS. So this is my stab at a chart, because I don't have specific data, but I'm trying to show that the Minnesota chapter had the most time invested in creating this tool. They presented it 2014, they've updated the information, they did beta testing, and then the Greater Philadelphia chapter took their initial version of the tool and added and edited, made videos, and put their information into it. So what I was able to do is, from the Iowa chapter, is to talk to these wonderful agencies and say, can I use what you have already created? And they were very, very willing, very generous. And then also I want to say that the Oregon and Southwest Washington chapter had some beautiful information about communication and assistive technology that they were willing to share with me as well. So it was just me rewriting and editing the material that I had gathered over a course of like a year. And it took a while. I don't recommend it. Also, I would say that I did have some help at the beginning in creating the PDF, interactive PDF through InDesign, someone who knew what she was doing, and then she quit. So then I had to learn how to use that tool. And so there was some time it took to learn how to use a new program. So the financial efficiency piece, which I've already nodded to, collaborating and not reinventing the wheel is huge. And despite our lack of staff, we're a very small chapter, a very small office, we were able to do it. And we wouldn't have been able to without the help and the sharing of other chapters. And the InDesign program, which I referenced, you can actually pay about $20 a month and get a web-based version of it to create your own interactive PDF. It's a wonderful tool. It's like Publisher on steroids, is what I would say. So it's nice. So new ideas and information. Always love coming to conferences like this, getting new ideas, ways to do things, and sharing that information with others. And I've always said, I love my job at the ALS Association. I did hospice for 12 years, and sometimes I think I got a bit cocky when I was doing hospice because certain diseases are so predictable. But ALS is so unpredictable that it keeps me humble and always open to learning more information, not only from all of you, but from the people we're serving. I love this job for that reason. You're always learning new information. So it encourages learning, and now I have a new way to share that information. Because I don't know about you guys, but I've come to a few of these conferences over the years, and I'm really excited, but I have no time to implement or follow up and do that. And this tool offers me a way to plug in those resources. Like I was listening to that beautiful dietitian booklet in nutrition and eating. I'm like, oh, I'm putting that link on my website. You know, it makes me excited about, it's a structure. It offers a structure. So hopefully imitation is the highest form of flattery. And this is my nod and my joke, but it's true. So I hope that the Minnesota chapter feels like a rock star, and for me that's Dave Matthews Band. I love Dave Matthews. And then I hope the Greater Philadelphia chapter feels like Ray LaMontagne. He's the opening act, but he's also very good. And then the Oregon Southwest Washington chapter, I hope they feel like the featured IPA at the event, which is very, very, very good. I love IPA, and Breakside Brewery would be the choice for my IPA, just so you know. Wherever you are, you can send that to me if you want. So I love them all. They're all equally important, no matter what they gave. I just really appreciate the sharing. So, and also, I started looking at other ways I can collaborate. I don't know about you guys, but volunteer hours and free hours, work that other people have already produced, it's the best way to get that synergetic impact in your own work. So, increasing the strength of shared purpose. I already talked about that. I have a lot more improved information and material because I have a place to put it now. And so I actually keep on my desktop a Word document, it gets all the running ideas of things that I'd like to plug into the tool. For instance, I'm on the listserv for communication and assistive technology. And the other month, there was something on there about female catheters, external catheters. And it's such a rare piece. So I'm like, I am so plugging that information into our tools to give that to females coping with ALS. So I have to give a nod to the barriers that might exist with doing an online resource tool. We are a very rural state. Iowa is in the Midwest. We're not Idaho. We're cows and potatoes. So, not potatoes, cows and corn and pigs, not potatoes. That's what I meant to say. So we do have people that don't use the internet. We do have people that don't have access, and that is somewhat of a barrier. Our families we're able to print some items, and usually the families that don't have internet have a family member who does, and so then they are sharing the information. The format we use, the InDesign, the interactive PDF, has a bit of glitches, and it's not perfect. We've been encouraging folks to download the document onto their tablet, their computer, laptop, and then using it from there, because if you click on a link and you're in the web browser, and you hit the back button, you're going to go to the top of the page. And it's super annoying, and it takes a lot of time. So we encourage folks to download it, have it on their computer, and then they can reference it at different times. And the links don't always work. It's not perfect. So the barriers are if you don't have enough staff to actually complete or create a guide, it's going to be difficult to do it. And then information uniformity, even though a benefit, could also be a detriment. So you want to be really sure before you're putting stuff online that it's stuff you want to share and you feel confident about sharing. So that's why I loved being able to collaborate with other chapters who had already tested and had that information. I didn't have to think twice about adapting because I trusted those resources and those sources of support. So again, a nod to the other people. And then this is not an experience that I had collaborating with other chapters, but I have to give a nod to it because it does exist. These are possible barriers, especially international, if you're going to be working with other agencies that aren't within your own organization. I think that it's important that you chat about ensuring its credit is specified and how you're going to do that. I think the human ego is the absolute ultimate detriment to collaboration. There's a great article online I'd encourage you all to read, but the key is that if you can join together on the purpose, the common purpose of providing resources and support to people living with ALS, MND, then you're going to get so much further. And then, of course, we had an established relationship with these other chapters. So it made it really easy to reach out to them and say, hey, can I use your stuff? Would you be willing to share it? But I know that doesn't always happen. So unless you're in it in the long game, like you can develop a relationship with other agencies or chapters that you'd like to use their information, it's possible, but it would just take longer. So what are my recommendations? Collaborate. The tool we've created is 1,000 times better than what it would have been if we tried to do it on our own. And again, it's the boom effect, the synergy effect. So, and I would highly recommend having 3 or 5 people, if you can, help you do it. You're going to get exhausted and have a few sleepless nights creating it if you do it on your own. It'll also take longer, which it did. And then create a maintenance plan. We actually use all our office staff to read through the document every 3 months, and they take the different pages and they check all the links. They read it to make sure it flows well. They look for spelling errors, different things. And then we take that information and we plug it in and we update it. Also, like I said, I keep a Word document of things I'd like to add. I'm doing that today. And then when that 3-month comes up, instead of doing it ongoing, I do it at the 3-month quarter. So that's a time saving as well. So, and then I encourage people to use a tool like this. It's absolutely wonderful. And so I want to thank the collaborators, the Dave Matthews Band, Ray LaMontagne, and the IPA of my choice. And then I can't click on that, but when you guys get the slide, those are how I wanted to list out how you can go and look at all the different agencies' websites. So you can kind of see what it's like and take a look at if it's something you'd like to use or how you'd like to proceed. And that's it. That's who I am.
So a big thank you to Krista. I mean, the presentation's now open for question and discussion. So do we have questions? Please raise your hands.
Hi, I'm Erin Springer. I'm actually the nurse coordinator of one of the clinics that Krista helps staff. I just wanted to encourage all of you, if you have time, to go out and look at this. It has been revolutionary in the way that we're able to give information to patients. I don't have to hand out a bunch of handouts at clinic. I don't have to worry about how long it takes to get information mailed to a patient necessarily. I go on, basically say, go to this tool, click on this, and there's information right there. There's information about disability, about transportation, about equipment, about different symptoms and how they can actually manage those at home. And after every clinic that we have, the great thing is that Krista actually sends out an email to each patient or family telling them exactly what we talked about with the link and what page to find the information on, and so they can actually follow up. And oftentimes there's kind of an email chain then that goes on if they have questions after that. So it's a great document that she put together and had help from these other people, but I would definitely encourage you guys to go and take a peek at it.
Thank you. Any others?
There's one.
Hi, I'm Kelly Casey from Johns Hopkins, and I just wanted to ask, how do you exactly access this resource? Because I've been onto the Iowa website since you've been talking. It seems amazing.
Like I said, I talked to the Minnesota, North Dakota, South Dakota chapter. The initial version they have for the Greater Philadelphia chapter was that first initial version. So, and then I just chatted with the resources and they gave it to me. They emailed me the link. I had to get the program, and then I went in and I edited it based for Iowa and maybe content I wanted to add.
And how can we access it?
So just chat with Minnesota, chat with myself, chat with Dave Matthews, Ray LaMontagne, and IPA, and you'll be good.
Any others? No? Okay, so thank you again, Krista, for
pleasure.
that presentation. Thank you.